All right, good afternoon, everyone. This is Sarah Clark here with the Division of Certification and Testing at ONC, also lead in real-world testing, and going to be presenting on real-world testing results reporting requirements today. Just a note that this presentation is intended to assist developers in meeting their real-world testing requirements. The materials contained in this presentation are based on provisions at 45 CFR Parts 170 and 171. And while every effort has been made to ensure the accuracy of these restatements of the provisions, this presentation is not a legal document, and official program requirements are contained in the relevant regulations. All right, well, first and foremost, we'll go ahead and do a bit of a recap just to level set here on real-world testing. So as we all aware, having done these webinars several times and being in the second cycle of real-world testing is a condition of certification where it requires that health IT developers undergo a process where they demonstrate interoperability and data exchange functionality of their certified health IT in real-world settings and scenarios rather than in a controlled testing environment, such as when you undergo testing for certification with an ONC authorized testing laboratory. Real-world testing does verify that deployed health IT continues to perform as intended. It verifies this through conducting and measuring observations of interoperability and data exchange. And these observations are described in a public and transparent way through real-world testing plans and results reporting. All right, now who is required to conduct real-world testing? This condition of certification is for health IT developers that are certified to one or more of the applicable certification criteria that are outlined at 170.405A. As a maintenance of certification requirement for real-world testing, health IT developers who are subject to real-world testing are required to submit a plan every year to be made publicly available by December 15th. Also required to report on their real-world testing results and to submit those results to be made publicly available on the Certified Health IT product list, the CHPL, no later than March 15th of each calendar year. And they're also required to notify their respective ONC ACB of any nonconformity identified through the course of their real-world testing activities. Now, reference the certification criteria applicable for real-world testing. These are listed here: care coordination, patient engagement, CQMs, electronic exchange, APIs, and public health. All interoperability data exchange criteria. These are in the scope of your certification, and you are subject to these real-world testing requirements. So to get into real-world testing and reporting on those results, which modules should be included in your results reports. The results reports must be submitted every single year, and the results submitted should be based on and directly related to real-world testing plan submitted for that preceding calendar year. All right, this is a process that is required on an ongoing yearly basis. And so I know that everyone has seen this timeline many times before in previous webinars, but we want to just focus on where we are today, as you guys have all been through 2 rounds of plan submissions, okay? So this is the first round of results submissions, and so we want to make sure that everyone knows exactly which health IT modules they're going to be submitting in the upcoming results report that must be submitted and made publicly available by March 15th of 2023. So you guys submitted your plan for 2022 real-world testing back in 2021. You executed that plan in 2022, and then you recently planned on how you're going to conduct your real-world testing for 2023. That 2023 plan was submitted in 2022 as you were wrapping up your 2022 plan, and you had to have that one made publicly available on CHPL no later than December 15th of 2022. So you guys have submitted 2 plans had you been eligible for real-world testing in the first year of real-world testing. And so now you're going to be reporting on that. The results report that is due this coming March 15th is going to be based on your 2022 real-world testing activities. So the plan that you submitted in 2021, executed in 2022, and just wrapped up, those health IT modules that were addressed in those real world testing activities are the ones that should be included in your results submission for March 15th of 2023. All right, so just kind of want to make sure we understand, how this overlap happens and which modules apply to which year's results reports and plans. All right, so just speaking about that yearly ongoing life cycle, just kind of wanted to give a visual on how this is all playing out based on where we are today. Because the planning, conducting, and reporting on real world testing of a given year, definitely those activities are going to overlap from year to year. So just to talk about, 2022 real world testing versus now we're entering into a second cycle of real world testing. We're going to use two modules to sort of kind of flesh out where we are now and what your responsibilities are at this point. So module 1, we're going to say was eligible for real world testing for 2022, calendar year 2022. So those activities have kind of gone from 2021, and now you're wrapping them up in 2023. Where in the meantime, we have an example of a second module that was eligible as of 2023. So maybe it's a new product and it's just become eligible for real world testing in 2023. So as you guys know, for module 1, you submitted your plan based on eligibility in 2021. You executed that plan in 2022. And then here we are today, where you're coming up on the deadline to submit your real world testing results from those 2022 real world testing activities. For module 2, was not included in 2022 real world testing. Maybe again, it's a new module. So based on eligibility in 2022, it was included in your 2023 plan. So that module is not expected to be included in your results report that's due in just about a month and a half here, March 15th of 2023. That module should be included in your 2023 plan that you should be starting to execute and work through for 2023 real world testing activities. And those results will be reported on in March of 2024. So this is just a little bit to help you keep track of the overlapping activities as you work through your cycles of real world testing. All right, now, while we're talking about included modules for, real world testing results reports, we want to make sure we touch on inherited certified status. Inherited certified status allows developers to update their products to a newer version without getting additional testing with an ONC ACB, should the ONC ACB determine that whatever updates the developer made to that newer version do not adversely impact the product's ability to meet the certification requirements within the scope of the certification. Okay, but when this happens, a new listing is created on the chapel for this new version, and that changes the certification date, even though it's essentially the same product and functionality, because that is in essence, what inherited certified status allows is for you to get a newer version certified based on the fact that no changes have impacted the certified capabilities. So with that being said, ONC is aware that some developers update their certified health IT, leveraging the inherited certified status flexibility, and then withdraw the previous listing. And sometimes this doesn't happen on a timeline that aligns with real world testing requirements. And so if this type of update using inherited certified status happens after the August 31st deadline for certification for modules to be included in the immediately following year of real world testing, that newer version is going to also inherit the real world testing eligibility. So what you want to do, if you choose to update via inherited certified status, you want to be sure that you include that newer version in your real world testing activities for the year of the eligible older version. Okay, so in other words, if you include it in, as a matter of fact, let's go to this one. So in other words, if you look at this visual, developers who do choose to leverage inherited certified status, we give actually an example here to kind of give you a clear idea of what this looks like for you should you decide to update using this flexibility. So let's take module X which was, let's say it was certified in October of 2021. So notice that October 2021 falls after the August 31st, 2021 deadline for modules to have been included in 2022 real world testing. All right, so it was not in your 2022 plan, but as of August 31st, 2022, it was eligible because of the certification date. So it's been included in your 2023 real world testing plan that was submitted and made publicly available December 15th, 2022. Now we're in 2023 and you start to execute your 2023 real world testing plan, which includes Module X. And then you decide in April of 2023, you want to make some updates and you certify Module Y. Module Y is a newer version of Module X. You certify Module Y under the inherited certified status flexibility. The developer then withdraws Module X because Module Y is the newer version. And so for whatever reason, did not feel a need to continue to maintain the certification for Module X. So in this case, you are expected to report on real-world testing activities that were applied for Module Y because Module Y not only inherited the certification from Module X, but all the requirements that came along with that certification, including real-world testing. So you would be expected to still report on this product, even though you updated it using inherited certified status, okay? All right, so just to kind of go off the deadlines, we've talked a lot about the December 15th deadline of each year for plans to be made publicly available on the chapel, the March 15th deadline of each year for results reports to be made publicly available on chapel. Just want to note here that for both testing plans and results reports, ONC ACBs have their own specific submission deadlines for developers to submit their plans and results reports. So you're probably very familiar with your ACB's plan deadlines because you've been through 2 cycles of plan submissions. But right now we're in a part of the real world testing cycle where you're going to want to make sure you understand what the specific ACB deadline is for the submission of your real world testing results report. Because today we're just a little over a month and a half out. And so you want to, if you have not been engaged with your ONC ACB, you want to be sure that you're meeting their internal requirements for them to ensure that your real world testing results report is made publicly available by the regulatory deadline of March 15th of 2023. All right, now another reporting requirement, not necessarily completely tied to the results report that is due March 15th, but a reporting requirement associated with real world testing activities is reporting on nonconformities. So we understand that nonconformities may be discovered during real world testing. It's totally, sort of the spirit behind why we do it. Developers are getting out and getting ahead of what's going on with the functionality of their products while they're being used in real world scenarios and use cases. And if this occurs, ONC ACBs already have processes in place to help developers, self-report on nonconformities in a timely manner and work with the developers to have them corrected. I will note here that the provision states that developers must report any nonconformities to their own ONC ACB within 30 days. Any nonconformities that are found throughout the real world testing process as you execute your plans must be submitted to the ACB within 30 days. And so you just want to make sure you're familiar with your ACB's process for self-reporting, communicate it within 30 days if a nonconformity arises so that you are still compliant with program requirements. And you're going to work with the ONC ACB to develop a plan to correct them. So again, self-reported nonconformities are just the health IT developer getting ahead of what's going on, making sure that you're on top of, how the functionality plays out when it's actually been deployed and used in a real setting. So this is a reporting requirement that we want to make sure we touch upon as we get into the actual results report and how to design one. So getting into that, we did put out an optional template, the same as we did for real world testing plans. This is totally optional, but it was designed to basically help health IT developers outline all the necessary elements and gather the information in a way that makes sense and is easy for you guys to sort of, submit to your ONC ACB for your ONC ACB to assess for completeness, to make sure you hit on all the elements. So this template, again, is not mandatory that you use it, but it should definitely assist with how to organize this information and make sure that you pass your completeness check with your ONC ACB. And then we always want to note to be sure that you are consulting your ACB on any and all requirements for submission so that you can make sure that you meet those with your respective ONC ACB. All right, now we know we've gotten questions around, do we do one plan? Do we do one results report or multiple? We've even received a question around, well, if we did two plans for, our modules, but then we want to kind of consolidate the results report. We have spoken on this in the past, and we want you to know that the developer has full flexibility to structure your real-world testing plans and results reports in any way you think would best convey the information that you want to convey. Some developers we saw covered all their product versions and criteria in one real-world testing plan, while others created multiple plans. Whatever approach you took as a developer when you designed your plan, ONC recommends that you take that same approach for your results report. And the reason for that is so that it's easy to sort of look and compare the two documents and reconcile both documents, okay? It just makes it for an easier flow of the information and to kind of, report out on what it is that you did in your real world testing activities. So this is our recommendation. We do know that, you might find that you would prefer to do it differently going forward. So what we recommend, and if that's your case, is that for your next plan, you make those tweaks there, and then you can align that with, the results report associated with that particular year's plan in that way, as opposed to switching that approach from a plan to a results report for the same year of real world testing. All right, so hopefully that makes sense to everyone. And so now we're going to get into designing the real world testing plan and the required elements that must be included. So for, just like for your real world testing plan, your results report must include specific elements. And those are here displayed, where any changes to the real world testing plan that occurred during the execution of the plan, why those changes occurred, and the impact on the intended outcomes of the testing. This is for folks who may have deviated from their plans for whatever reason. Maybe you got into your real world testing activities and found that, you may have had a better approach to, getting the expected outcomes that you laid out in your plan. Any of those kinds of changes you want to go ahead and reflect in your results report. We have, received questions around if you're supposed to do an updated plan. I think we've, definitely spoken on that in the past to say, no, you do not have to update your plan. Your results report is where you're going to describe those changes. So we have that here as an element. We have the testing methods and methodologies that were used to demonstrate real-world interoperability and conformance to the full scope of the certification criterions required capability, okay? And then we have the care setting types that were tested for real-world interoperability, voluntary updates to the standards and implementation specifications approved through the standards version advancement process, as well as any mandatory standards updates that you may have incorporated into your health IT. That were included in your real-world testing plan for the year that you're reporting on, a list of key real-world testing milestones. All of this is directly linked back to what you put in your plan, and we'll get into how you report on that. A description of the outcomes of real-world testing, including any challenges you encountered, and then in the challenges piece is if applicable, and you'll find that there's some if applicables in the template. Just to give you an opportunity to give a full scope and perspective of, what you want to report on in from your real world testing activities. And then lastly, the metric or measurement And it must be at least one here associated with your real world testing. All right, so I kind of went over this. This is an FAQ about reporting changes to the testing plan. I already sort of spoke to that. Just want to point out in the third bullet that the results report template is going to prompt you to, describe the types of changes that were made, the reasons for the changes, and how the intended outcomes were more efficiently met as a result of these changes, okay? So this is just for reference, but this is all around, how you want to address your deviations from your plan, because again, it's not that you can't deviate from what you put in your plan, but we just want to hear about what came out of that deviation and how it impacted your expected outcomes. All right, now we're going to touch a little bit on inclusion of withdrawn products, because this is sort of a, deviation from what you planned on doing, right? Some developers in some cases may withdraw their real world testing eligible module before the submission of the results report, right? And so we have developers who want to know, well, what do we do if we withdraw before the results reports are due? So if this occurs, developers should definitely include in your results report information about the withdrawn product, okay? You want to, touch on the product name, version number, CHPL product number, the dates withdrawn, and specify whether any data from that product will be included in the real world testing results report, okay? Developers do not have to include results from withdrawn products in their results reports, but can do so if it supports their demonstration of real world interoperability and data exchange. And the example that I'd like to give here is, for inherited certified status, we just talked about it, right? Inherited certified status is a flexibility that many developers leverage. A lot of them do them on a specific schedule. So let's just say you have like a quarterly schedule and you update your product every quarter, not changing the functionality of your product, but just doing whatever patches, bug fixes you do that do not adversely impact the certified capabilities. So if you do that on a quarterly schedule, then you might want to report on each quarter of real world testing where you used an older version of that real world testing eligible product, but it got later withdrawn when you updated it to the newer version, okay? So that's a situation where I could see a developer saying, well, hey, I want to report on all 4 versions that I used throughout the year, based on my quarterly updates, because that's how I'm going to demonstrate successful real world testing. So that's just an example of how you might want to think about reporting on withdrawn products, is what value will it bring to your reports. All right, now for standards updates, the ONC CARES Act final rule required developers to update their certified health IT modules to certain specific standards associated with specific certification criteria. And in addition to mandatory updates, we have the SVAP program, where it's a voluntary program for health IT developers to update to newer versions of standards that we've already adopted in the program and that are approved by the national coordinator. So for either type of update, whether it be a mandatory update or a voluntary update, it all must be accounted for in real world testing. So as an example here, you might have leveraged SVAP at a time that made you eligible for standards updates to be included in your real world testing plan this year for 2023. Maybe you leveraged SVAP earlier in 2023, and by August 31st, maybe you leveraged SVAP earlier in 2022, and by the August 31st deadline for these to be complete in 2022, you had already completed them, okay? So you have those updates included in your plan for 2023. You're not reporting on those in this upcoming results submission cycle for March of 2023. You're going to go out and test that this year in your real world testing activities, and it will be included in next year's results report. But anything that was included, has to be any standards updates that were made certainly have to be accounted for in real world testing, whether they were voluntary or mandatory. So a lot of people just completed some mandatory updates that had to be done by December 31st of 2022. So you can expect that in August 31st of this year, 2023, that you will be putting those updates and incorporating those modules into your 2024 real world testing. So just want to make sure that folks understand, how this all works in the timeline. And so unless you had any standards updates included in your 2022 plan, then you would not have to report on them this year. If you did have standards updates, whether voluntary or mandatory, included in your 2022 real world testing plan, then those will be reported out on in this upcoming real world testing results report submission. Now, in the results report template, we note the developers must report on and indicate whether they made any voluntary updates to the standards for certified products. And then for any, whether voluntary or mandatory standards updates, you have to provide the standard and the version, the updated criteria and associated product, the CHPL product number, and how you measure conformance, okay? And then here's the link to, all the SVAP stuff, just to make sure you have all your bases covered and you can check on, what updates you've made. All right, now for care settings, excuse me, we just note here that you specified in your real world testing plan the types of care settings that you intended to conduct your real world testing in. Those types of care settings should have been based upon the types of care settings in which you market your health IT. And so you have to report on how you actually executed that, which care setting types you actually conducted the real world testing in. We note again that not each care setting must be included in your real world testing, but you must touch on each care setting type, okay? And we just stuck this FAQ in here that I know many of you have probably seen in the past, just to give you some ideas and just to remind you that ONC does not specifically define or limit care setting types, and we leave it to the health IT developer to determine which care setting types they need to cover based upon their knowledge of how their products are being marketed. And so we did give some examples of care setting types to just make sure, as you're preparing your results reports, that you, one, look at what you put in your plan, and two, make sure that your plan even covered all of your care setting types. So care setting types, just make sure that, even if you got out there and started to conduct real world testing and you found that there was a care setting type that you covered, but you didn't include it in your plan, by all means, feel free and, cover it in your results report submissions, because then that shows that you've covered every care setting type that you intended to cover, and that covers the marketing of your certified health IT. All right, so if you reviewed the real world testing results report template, you'll probably be familiar with a table that we have there. And we put that table there to sort of help to connect the dots with some of these elements that are required, by the submissions. So you want to talk about the measurement and metric that you use, to assess conformity and how successful your product is at meeting the interoperability and data exchange functionalities. Obviously, everyone knows that all of the associated certification criteria, the real world testing applicable certification criteria has to be touched on. So each criterion in the scope of your certification that is real world testing eligible, you have to sort of speak to every one of them when it comes to these elements, and then the outcomes of those measurements. Now, we do have in this table two, if applicable, boxes, and that's on the relied upon software. And I want to talk a little bit about relied upon software, because we want to make sure that when we say that the real world testing covers the full scope of the criterion that you're considering, any third-party relied upon software that was used to meet the original certification requirements for the original testing and certification process, that is sort of considered like a bundle, if I could put it in a more layman terms, and it must be used together, because that third-party relied upon software was assisted in meeting those certified capabilities. So we have a section there that allows you to list out any relied upon software and how you incorporated that third-party software into your real-world testing activities. And then challenges encountered is really just about share with us what you'd like to share with us or any additional context if applicable. Okay, so this is outlined here this way so that you can understand sort of how we trying to help to connect the dots in the actual template. And there's a table there where you can kind of combine all this information. All right, so just as a reminder for that there were favorable factors for measures to be used in real world testing, and then there were unfavorable factors, right? So now that we're in a place where you're reporting on your actual outcomes of your real world testing and the results of all of those activities, we just wanted to kind of remind you that, these are sort of the types of data and the types of collection methods that are favorable. And if you find that when you're developing your real world testing results report that you have some pass fails or some yes nos, or you don't really have, the more favorable factors, you're finding yourself kind of describing these activities and more unfavorable factors, then you might want to consider, reassessing how you are looking at the data derived from your real world testing activities and making sure that you're reporting out on them in a way that demonstrates true successful real world testing, okay? And again, the use of real patient data does not require the use of identifiable data. We actually do not recommend you include any identifiable data in plans or results reports. The guidance to use real patient data just suggests that the measure of real world use should be based off of production data instead of synthetic data. All right, so this is just a reminder that as you're developing your results reports that you go ahead and make sure that you're not sticking in there unfavorable factors. All right, now for the outcomes, health IT developers detailed in their plans how the approaches that they chose will produce some expected outcomes to reflect successful real world testing. And those reflected outcomes should have provided transparency into what current and potential customers would know about your certified health IT and its effectiveness in demonstrating interoperability functionality in real world settings. It should have reflected what should not be a result, or could have reflected what could not be a result of a given action. It should definitely be measurable and indicate the level at which the certified health IT is providing optimal user experience for customers and its stakeholders. So when you think about your outcomes, right, you want to go back and look at what you said you expected, okay, what actually happened, and then kind of do that assessment and report out on the results in that way. So again, just because you put an expected outcome in your plan does not mean that the outcome that you received, if it is different from that, or if it, there were some adjustments that needed to be made, you would just describe all of that in your plan. It's not to say that expected outcomes have to be the actual outcomes. It's just to say your expected outcomes were based on what you saw as successful real world testing for your specific module. And so the outcomes that you actually received, you want to, speak to, how those related back to your expected outcomes and, how they demonstrate successful real world testing. If they are different, whether they're different, the same, or whatever have you, the outcomes from your real world testing, you want to make sure you describe how those demonstrate successful real world testing. All right, and then there were key milestones that were touched on in your plans, okay, for conducting certain steps within your real world testing activities, what procedures, processes you will go through to execute your plan. Those milestones should have been relevant and directly related to your expected outcomes, right? Because you took certain steps to generate and collect certain data and that you're going to report out on. And so you just want to talk about, how those milestones played out. Did they have to be adjusted? Did you meet them? So you should include in your results report a list of those key milestones that were met during your process, include details on how and when you implemented the measures and collected the data. Those are all milestones, okay? So just, speak to what actually happened. Again, if it sort of looked a little bit different than you imagined and what you put in your plan, that's totally okay. You're just reporting out on the actual events and the actual milestones that were met throughout your real world testing. And we always like to touch on these special scenarios. We're well aware that, every developer, health IT has sort of different scenarios that you guys have to deal with, different circumstances under which you've been certified. And so we like to touch on these because these scenarios may have informed what measures you selected to include in your real world testing plan. And so I want to make sure that you are reporting on those as well. So there's the relied upon software, which I touched on a little bit in an earlier slide. There is the resellers of certified products, cloud-based products, and then products with non-deployed capabilities or low adoption of capabilities. So for the third-party relied upon software, I actually spoke to this when I was, talking about the template and why we asked for you to put it in there in the table. Because again, any relied upon software that was used to demonstrate conformity with certification requirements must be included and addressed as part of your real world testing. So even if you, had third-party software and you maybe did not include it in your plan, still speak to it in your results report. This is just something that we wanted to make sure everyone is understanding, that real world testing addresses and verifies that the full scope of a module's applicable certification criteria functions as intended by the certification. Okay, so that third-party software must be addressed. This should be identified along with the associated certification criteria, right, for any metrics for which you are going to report out on in your real world testing results report. So any criteria that you have in the scope of your certification that's real world testing eligible, that use third-party software for certification, that third-party software must be addressed and reported on from your real world testing activities. Now for cloud-based products, just really quickly going to touch on this. You're going to still need to report on all of the care setting types in which your cloud-based products are deployed and being used, okay, and marketed. We understand that it may seem like redundant or, like you're kind of going through the motions, but because a care setting type is an element that must be captured in your real world testing, because you are required to conduct those observations and collect the results in each care setting type, even if you are cloud-based and you roll, the way you roll out your updates and stuff and the way you roll out your functionality, you still have to cover those different care setting types, okay? It's not really about this particular element. Is more so about covering the different types of settings that are being used so that you have insight into all of the different types of use cases and workflows where your certified health IT is deployed, okay? So just want to make sure that you're reporting on each and every care setting type in which your certified health IT is marketed. All right, now resellers of certified products. Okay, so we have and allow, we have a flexibility in our program that we've adopted where we allow developers to partner with distributors and allow those distributors to market their certified product without having to go through any kind of certification. That product has already been certified. This is based on a business relationship between the developer, original developer who sought certification, and their business partners. And the developer is responsible for communicating all ONC Health IT certification program requirements to those resellers. And that is to include real world testing. So when your products are being remarketed, ONC does not specify whether or not the reseller or the original developer is required to fulfill real world testing, okay? We do permit the inheritance of plans and results by developers to their for their authorized resellers to leverage so that they can meet these requirements. But if it is a listing on Chapel that is being displayed as certified, these requirements are mandatory, okay? So you want to be sure you're working with your partners and distributors to ensure that you have a good handle on, one, them understanding that they are held responsible for these requirements, and two, that you guys have an understanding of who's taking on what part of this responsibility. The one caveat that I want to mention is that I just talked about care setting types, right? And so you, as the original developer, may have covered all of your care setting types in your real world testing. And let's just say that you are a developer that's allowing for the inheritance of your plans and results reports. Well, if your reseller is marketing the certified health IT in a care setting type that you don't market it in, then that care setting type still needs to be covered. And so it's up to you and your distributors to determine who's going to conduct real world testing in that specific care setting type that you as the original developer don't cover or don't market your product in. All right, so these are just sort of the different kind of nuances to how you want to what you want to make sure you address and cover for your business partners and distributors of your certified health IT. All right, and so I'm sorry. Okay, so products with non-deployed capabilities or low adoption of capabilities. So this is one that we've, provided a lot of guidance on in the past. And so now we're coming full circle. We made it, we provided clarity on the fact that no matter whether you have non-deployed capabilities or no adoption of capabilities, that you still had to include these modules and these address these certification criteria in your plan, okay? So now we're coming back to results reporting where you've closed out your activities and, you have to report on how that went for you, like your attempt to get into a real world setting where you can observe the functionality of these non-deployed or low adoption capabilities. And so, we understand that in these instances, it could get a little tricky if you don't have customers on them or whatever have you. But again, health IT developers have full flexibility to be as creative as they need to be sure that they get some sort of real world observation of these capabilities. And so in previous webinars and resources, we have stressed that, developers' flexibility in determining how to meet these requirements, in a way that minimizes burdens on the users, but also optimizes value of the testing activities is totally up to you. And we also have spoken to, if all else fails, some of these flexibilities may include the use of synthetic patient data in lieu of or in addition to real patient data, or the use of simulated test scenarios and things like that, but that mirror production environment. I mean, that's the key here, is that you create a scenario where you can mirror the production environment so that it's really assessing the real world use of the functionality and that it still meets the certification criteria. And as we stated previously in previous guidance documents and resources, if all of this fails, you still have to report out on it in your real world testing results report. So, whether you were able to get in, maybe you were a developer who had, non-deployed or low adoption capabilities, but you were able to, find, a setting and one of your customers were willing to let you come in and see how it works. And maybe you were able to successfully conduct real world testing on those capabilities. But maybe you tried to get into the door and you couldn't get in to do the observations. And then you tried the simulated test scenarios or environments that mirror production environments. Maybe you try the use of synthetic data in lieu of patient data, and maybe you just don't believe you got the results that you were looking for that really truly demonstrate successful real world testing. It's okay. The requirement is that you still report on that, okay? Because that will demonstrate to your ONC ACB, it will demonstrate to ONC that you still did everything you could to meet these requirements. And you're just going to report on the data that came out of those activities and those efforts, okay? So again, these capabilities, whether they're non-deployed or have low adoption, and are not being used by your customers still required to be assessed in real-world settings to demonstrate interoperability and data exchange. And we just want to make sure that you know that you have flexibility on how you want to address, making sure that you have those observations and, generate some results to report out on, and making sure that you feel comfortable with reporting out on whatever that looks like for you in the course of your real-world testing. All right, now so that wrapped up the elements for your real-world testing results reports. Just want to make a note here that developers must make past and current plans and results reports available via a URL hosted on the Chapel. So we're talking about this landing page because we did find that in the first calendar year of real world testing 2022, that some of the URLs link directly to a PDF. And so we've provided some guidance on our previous webinars to say, like, hey, heads up, you're coming up on another year, you're about to submit another plan that's not going to work, that linking directly to a PDF. You might want to consider having a landing page, because your link should link any one from the public to all current and past plans and results reports. And so we're really wanting to encourage folks to get ahead of it and make sure that you're hosting a landing page where all of these reports and plans can be accessed. The Chapel allows for publication of one link for plans and one link for results reports. All right, you can choose to use one link for both plans and results reports, but you have the option to use two, one for each. All right, and then to just ensure your continued access to current and previous years results reports, a landing page to all of these documents that can be accessed from the link that's hosted on the Chapel is the direction that you want to go in. And so just be sure that you are familiar with how your link is being managed, and make sure that right now your URL for your plans should link to not only your 2023 plan, but should also link to your 2022 plan, because that plan is from a previous year. All right, so hosting a landing page is probably the best way to go about making sure that the public has access to past and current plans and results reports. And to wrap up, we're just going to go through some of our resources here. A lot of what you're hearing today was incorporated into the 2022 resource guide update. Our real world testing resource guide is just really to assist developers in organizing the required elements related to the submission requirements for the plans and the results reporting. We really just want to make sure that folks have clear insight to the guardrails and, the way that you should be thinking about meeting these requirements. And so in 2022, we added greater clarity on the inclusion of inherited certified status products in real world testing. We spoke to creating a landing page for plans and results reports. We gave more examples on what to include in metrics, and we also provided this guidance on results reporting for what you do if you have changes that cause you to deviate from your plan that you're reporting on, and then how to address products that have been withdrawn. So here is a link to our real world testing page. We have a bunch of resources for you to access, a fact sheet that's just basically a high level. Here's what this real world testing requirement means for health IT developers. We have a plan template, which we also updated last year to incorporate some of these concepts into as we continue to put our efforts into meeting the information needs that we know are out there. We have a new results report template, which I just shared, an updated resource guide, which I also just covered, and we also have a real world testing certification companion guide, which points out clarifications and different text in our preamble and regulations. And then we also have all previous webinar recordings and slides hosted on our website, our real world testing webpage on healthit.gov. And so this one will also be, it has also been recorded, and will also be uploaded along with this presentation in the coming days. So everyone, that wraps up my presentation for today on real-world testing results reporting. We will have another on Thursday, February the 9th. That is 2 weeks from today. So if anyone missed this, please encourage them to go ahead and get registered for our second. This will be the exact same information here. Just want to give folks options on, flexibility on joining one or the other, or if you find that you want to join it again, just to get the information twice, by all means, we are happy to have you. So I just want to thank everyone today for your time, for joining our real-world testing webinar on results reporting. Please continue to reach out via our different our health equity feedback form. Our inquiry management system is really informative and helps us to create the content for these types of presentations. So, please continue to reach out, continue to let us know what your information needs are, and we definitely will continue to support through these education and outreach activities. Thanks everyone for joining. Everyone have a great rest of your afternoon.